To see is to know, and to not see is to guess. Hi, I'm Dr. Jake with Revive Chiropractic and Wellness, and I invite you today to learn a little bit more about your lower back. This phrase does not apply everywhere in our lives, but it definitely does when it comes to our health and looking at our spine. Way too often, chronic health issues like lower back pain plague people chronically because they don't know what's actually causing their problem. They actually can't see their problem. So I invite you to know how to do that well for yourself and your family. Now, many of us know that we should be straight from front to back and we'd have a problem if we were standing crooked. But many of us don't know that our bodies were designed to have three curvatures from the side, one in the neck, mid-back, and lower back. But our world wars against our lower back between our sitting and technology and our driving and injuries and yard work. We know that many people, just based on the thousands of people that we help and take x-rays on, that they actually lose that lower back curvature. And this can lead to disc problems. It can lead to sciatic problems. It can lead to so many different degenerations in the spine. And if we don't know that it's happening, we don't know how to take care of it, or even that we should take care of it. And so I invite you here. I'm going to show you what that looks like on x-ray. If you've never had an x-ray, I can't encourage you more to be able to take a look at your spine using an x-ray. As you can look here, this down here is the hip socket. This is this person's tailbone. You can see their hip bone and then their lumbar spine. Now, this is actually an example of a good lumbar spine on x-ray. We can see that there are good disc space here. There is a good curvature like we saw on the chart as well too. And so this is a healthy x-ray. Now, if we go ahead and we take a look at one that is not healthy, now this person had reoccurring pain in their life and were trying stretches, trying medications. They even went to the point of getting cortisone shots in here as well too. And the next step was surgery, but they were too young for that. And so they were left stuck. And they didn't know what was actually happening in their lower back here. And so if you look at this, you can see the top of the hip socket, the tailbone, and then the lumbar spine. What we are seeing here is that their lumbar spine is very straight. It's stacked up like blocks. We don't want to see this because when that happens, we actually see compression on the disc. And even this one you can see here is at about 10 millimeter of space where that disc should be, whereas the one right above it is at 15, almost 16 millimeters. So it's like a 30% loss of curvature, and that can cause pain, irritation, inflammation, and also can pinch on these nerves, causing some of the sciatic pain that is happening in this individual. But he did not know this was happening, and so therefore didn't know how to take care of it. So once again, to see is to know, and to not see is to guess. This is the main reason why so many of our patients get better, is they're able to actually find the root cause of their problem and then learn how to correct it and be empowered to do so.